Brilliant. So I'm really excited about this event. It's generated lots of buzz. I'm just going to tell you how the event is going to run, and then I'll hand over to Deborah Munt from Arts Derbyshire, who's here with Becky Edwards, Harriet Brown and Pete Bird. They're going to introduce the Link Worker Manifesto and play you a short film. After that, we'll have a short discussion of the manifesto with our guests, Richard Ings from the Arts Council, Najneen Islam from the National Academy for Social Prescribing, who's also a former Link worker, and Sarah Baines, who is the Public Health Lead for Localities and Place at Derbyshire County Council, and Marie Polly, who's from the Social Prescribing Network. Then we'll have a break, and then when we come back, we'll ask you to have some conversations in breakout rooms and then come back in for a more general conversation. So that's it from me. I'm going to hand over to Deborah now.
Good morning, everybody. Thank you so much for joining us today. I'm Deborah Munt. I'm a white middle-aged woman with long blonde hair and a short fringe, big glasses and a flowery shirt this morning. I thought I'd make an effort. So today we're here just to present to you a piece of work that is really a product of what happened during the COVID lockdowns, and it's a piece of work by Arts Derbyshire. And during the lockdowns, I kind of came into this piece of work, which is around how do culture and social prescribing knit together and meet in the middle, and then lockdowns hit. And so the thing for us at Arts Derbyshire was then a question of how might we be helpful in this situation. And so what we did was set up an artist-led support programme for link workers that ran for between 6 and 8 months, roughly every other week for a couple of hours on Zoom. The link workers are going to talk to you about their experiences of that and what happened. And before I just pass over to Becky, I would just like to acknowledge the link workers who were involved in this, because some of them aren't here. So with us today, we have Peter Bird, Rebecca Edwards, Harriet Brown and Naomi Martin, but 5 others were also involved: Neda Yavari, Jessica Solly, Tracy Crosdale, Debbie Rushworth and Laura Cowley. So thank you so much for all their involvement. So now I'm just going to let the link workers take over and tell you all about this. So Becky, please take the floor.
Thank you. Good morning. I'm Becky Edwards. I'm a social prescriber for community action in Derby, so Derby PCN North. For audio description, I have straight ginger hair, bright red lipstick, and I'm cheerfully wearing black, have a blurry cream background. So I'm just going to talk a little bit about what happened and how, and some of the ground that we covered during those sessions. So Deborah's kind of covered what the response was to. So the opportunity became known to me in about September 2020. The opportunity for Arts Derbyshire were running some artist-led opportunities to support link workers who were trying to do jobs, as everybody was, in really challenging circumstances. Particularly, you know, we're supposed to be a stepping stone from clinic into community, and community was closed, so we all had to think a little bit flexibly and really kind of think about our role in those times. And it was difficult. It was difficult for everybody, both personally and professionally. So it was a very interesting opportunity, and the idea of the artist skills kind of resonating with the link worker skills in terms of sort of their ability to use their imagination, their creativity and agility and curiosity, and notice those things that others might not, and experiment and adapt. And the only criteria that was asked for was a curiosity and willingness on our part. So my interest was piqued, and I was involved from the word go. So we agreed to work for about 6 months, and we met on Wednesday mornings. A group of about 10 of us, I think, convened, and we didn't really know each other. And the open-ended kind of artist-led sessions were led by Kate and Deborah. And it started with a box through the post, which was a lovely, lovely opening, because it meant that somebody was reaching into your space with an invite to play. And so in the box was a bunch of different objects, which was very interesting, things to play with that were going to play a big role in the sessions, and each session kind of responded to what happened previously. So we'd start with a really simple thing like looking at a button that described us and bringing that along. We made things with plasticine. We created biscuits to talk about self-care and keeping our last biscuit. And it quite quickly, probably because of the situation we were in, we connected very, very quickly, and it very soon sort of became quite personal linking in. And I really, really looked forward to having that space to have a sort of non-led open discussion to see where it led us and where we needed to be during that time. It became such an interesting space. And I think, and we had a handkerchief once that said what matters to me, and obviously that's a key question for any link worker working with people. So it kind of made us look at how we work with people, but have it done to ourselves as well. But that meant that we quite quickly connected on quite a personal level, and we talked about our families and our responses to lockdown, and free falling through fear, and where we found safety and joy. And we came up with a little booklet called Joyful Interruptions, and where we find those joyful interruptions in quite a monotonous time to be. Can't go to gigs, you can't go to theatre, nothing's open. So where do you find those joyful interruptions, and how do you kind of reframe your day and look for something different? And we invited people that we were working with to contribute towards that, and it's a very nice book, and I have about 3 million of them at Community Action if you want one. And then from that, we sort of looked at bubbling up themes. So what was going on in our families, what was going on professionally, and inevitably the discussions led to our work and how we were operating and how it was impacting on us. And that led us to where we're heading to today. So with that, I'll hand over to, I think, Harriet. Is it Harriet? Yeah.
So yes, I think, yeah, what Becky said when we were first started being part of the cultural prescriptions group, we didn't know where it was going to lead, and what Deborah and Kate did was were giving us that time and space that actually during the COVID lockdowns we were kind of all doing different bits of our roles, and some things that maybe weren't. So actually it was a bit of a break from that. Quite a difficult time, I suppose, but in that time and space, it led us to develop the manifesto, and actually it really reflected that time and space that as social prescribers and link workers we give to the people we work with. So it was really nice to see how beneficial that was for us, as well as the patients or clients that we work with. And I think one of the main things for me that was really beneficial about it was it gave me a chance to reflect on my own practice with the support of other social prescribers, and actually thinking about some of the challenges of the role, but also thinking about where we wanted to develop it. And it actually helped, me and my colleagues to develop how we worked with people as well. So it was incredibly beneficial for that. So hopefully seeing the video that we're going to present, which shows the manifesto in the sort of wording that Deborah and Kate came up with. We sort of said it, they interpreted it in this really impressive way. But some of those challenges that we were experiencing at the time, while they were quite COVID focused, actually some of them may be relevant still today for link workers potentially working in circumstances they need some support with, and also kind of focusing in on that, I suppose, that quality of what you're providing to people over the quantity of people you're getting through your service, and making it a very servicey model. I think having those discussions within the cultural prescription session really, I suppose, emboldened me to have conversations with my PCN about the way that we needed to work as social prescribers, not sort of creating a new service that did all the things that social prescribing was hoping to counteract, I suppose, in the services that don't always work for people. And we're working with those individuals who kind of can't always fit in with the service model, I suppose. And it did lead us to have those discussions with our organisation, with our PCN, and I think it made things better. So that's the hope, I suppose, from watching this video, if you're a link worker or working within that space, to get get that thought process going about how do I work, and hopefully it'll help, you know, you reflect on the way that you work and or your colleagues work. So I think that's everything I was going to say. I hope I haven't taken away anything from Pete, but I will hand over to Pete.
Thanks, Harriet. Sorry about that. Hi everyone. Can you hear me? Yeah. I'm Pete Bird, and I work as a social prescriber in North East Derbyshire, a role that I've done since January 2020, so about 2.5 years or so now. Yeah, I was involved with the Cultural Prescriptions project from the start with my ex-colleague Jess Solly that Deborah mentioned. Yeah, the manifesto grew from the conversations, I suppose, that we had during the time we spent together on the project, and those conversations revolved around quite a wide variety of topics. It's been about a year or so, I think, since the manifesto was finished. So as Harriet alluded to, the landscape has really changed in some very important ways, because it was conceived under COVID, and now, you know, although the virus is still with us, things look brighter. Things are beginning to open up a little more. So I think that for us as link workers, our jobs have become a bit easier. I think it's fair to say. So some things have changed. But it was interesting to look at the manifesto and to see how much of it still really does ring true. One of the issues that came up time and again when we were talking during the project, kind of anecdotally, was the subject of our terms and conditions, if you like, of employment as link workers, and that's the thing that I'd like to say a few words about now. And it is directly referred to in the third part of the manifesto, as you'll see. It's a big subject, a very dry one, I think, sometimes, so I'm going to confine myself to a few short words. The first issue, I think, is pay. You know, we're not all being paid the same amount of money for doing what is essentially the same job. And for example, I recently saw an advert for a job not a million miles away from where I am, within 100 miles of where I live, which offered a starting salary which was about £5,000 less than the one that I started on. And I can't work that out. I can't work out why those things are as they are. And I think that it is something that you know, needs to be talked about. The job that I'm referring to did offer a salary scale, which lots of jobs don't. So some of them are fixed term on one salary, some are permanent with some progression built in. But so yeah, the issue of fairness and equitability, I think, raises its head. And in terms of pay, again, if you are a link worker out there, did you get the NHS pay rise last year? Some did, some people did, some people didn't. I suspect that the picture is very varied across PCNs and across community and voluntary organisations as well, where they are the employers. And the same, I think, can be said for leave allowances as well. I mean, they vary wildly across organisations. So NHS leave allowances are quite generous. Within PCNs and maybe within GP practices and within community organisations, they can be a lot less so. So it was something that came up regularly, I think, when we were talking during the development of the manifesto. And it's not something, I don't think, that clearly doesn't just affect link workers, but we're such a new role, and I think, you know, we're trying to embed ourselves, if you like. And I really do think that those things need to be talked about, sorted out, ironed out. And, you know, if this conversation can be part of that, then I think that's great. So, yeah, that's what I wanted to say. I'm sure there's a lot more to be said. So, yeah, we can start saying it this morning. Thanks.
Thank you, Pete. That's fantastic. I just wanted to mention also Kate Genever, who is the artist who couldn't be here with us today, who you will see on the manifesto, who did an amazing job and has a particular set of skills, a particular way of working within this process is extremely valuable. And I think we're ready to play the manifesto, Victoria, if that's okay.
Sorry, it's disappeared, but not for long. Here we go.
This is our Social Prescribing Link Worker Manifesto. Section 1. Why are we here? We exist because humans are complex, messy, social and emotional, and we need a spectrum of response from services to reflect this. We exist so that our nation's approach to health can be more rounded and wholehearted in response to its population. We exist because the medical model alone is not enough. We exist because we have a valuable skill set and an approach that offers something distinct from but complementary to medicine. We can see that the practice of social prescribing has phenomenal potential and at best co-creates opportunities for people to grow and flourish. We know that social prescribing cannot be done alone and is only as good as the partnerships involved.
What we can do. Link workers and social prescribing are, and always should be, a work in progress. Social prescribing is not new. Social prescribing within the NHS is. We're constantly searching for the edges of the work, for its fullest potential, and its nuanced nature means we should always be searching. Social prescribing is not and should not be prescriptive.
It is within our power to notice. It's been said that attention is the rarest and purest form of generosity. Very often, as human beings, not being seen or heard is damaging to our health and affects how we experience the world. In the business of life, it's easy to stop noticing, but we can pay attention. We have time. This is key. Our job is to treasure hunt.
We can hold space and leave room. For a while, we can be in the moment, not looking back, not looking forward, not striving. Human beings will always be work in progress, and that's okay. Just one step in front of the other means that often without realising, we are not only still standing, but we have moved. Perhaps it's our job simply to remind people of this. We can help people to take notice.
It is important to help people distinguish their own voice from all the others. It's easy to be overwhelmed by other people's voices and expectations in life, particularly when we feel different, be that permanently or temporarily. But difference is not a deficit, even if society often tells us it is. It is our job to ask, what's your voice? What do you want? And then, depending on what they discover, help them take the next steps.
We wrap ourselves round the shape of the individual, and what they tell us becomes the service. It's their agenda, not ours. We leave our assumptions at the door and help them to do the same. Our offer is our ability to listen, sit with, understand, and then build solutions with the client from their place of need and opportunity. We can help in the search for deep wins that last, not shallow ones that bring them back again and again. We see the assets rather than focus on the deficits.
Connection can be hard. Lack of connection or disconnection is at the heart of breakdown. It is our job to help re-establish connections and interconnections, and it's rarely linear. This is between link worker and individual and their communities, services and opportunities. But most importantly, it's between individual and what matters to them. It is our job to help people connect their own dots.
Find the fire in the belly. We can help someone re-find something that has been lost to them or buried along the way. Or perhaps we offer a chink of light that illuminates something new and remarkable. We let creativity and passions rise up.
We can help our clients with wayfinding as opposed to merely signposting. And this can mean many things. For some, finding the way might mean finding who they really are and becoming comfortable with it. For others, it might mean finding local services that offer practical solutions to practical needs. Or it may mean discovering an amazing new experience. It may soothe or provoke action.
We digress. The issue might look like one thing but turn out to be another. We discover this through digression rather than well-worn paths. Digressions often reveal the assets of a person rather than the deficits. We let things bubble up and then we follow.
Section 3, what we need. Social prescribing is full of potential on so many levels, for the system and for society, but more importantly, for communities and individuals. Link workers are clear that the things they need to fulfil the potential of the role are often not in place, and this undermines the work. This is what we need.
Number 1, to have our purpose and value acknowledged. We exist because we are needed. Our offer adds different routes to community health and well-being, but our routes are not the same as yours. What can be commonplace in one sector can seem unconventional in another, but that does not mean that they are wrong or unpracticed. Do not try to make our practice the same as yours. It would be a mistake to repeat the same gaps in services that rendered other services ineffective for social prescribing clients. Social prescribing in the NHS is bridging medical and social models, and at best is a place of great opportunity for making huge differences, and at worst, a place of great vulnerability and strain.
We need to be able to bring ourselves to the job. We believe that bringing more parts of ourselves to the job helps us and our clients. We respect the need for professional boundaries, while simultaneously noting that drawing broadly on our own skills, passions and experiences and sharing them appropriately with the clients helps to find the points of human connection that are the crucial bedrock of our work. Bringing a fuller version of ourselves that is not diminished, concealed or bent out of shape is enriching for everyone.
Recognition that our strength is in our spectrum of practice. The work of a social prescribing link worker is a practice. Each link worker develops their own based on their particular blend of skills, characteristics, knowledge and lived experience. Together, we will create a spectrum of practice, and this is a strength that will benefit our clients and our service. We wish to recognise and cultivate this in a deliberate way.
For us to do the job of supporting clients when they need it most, then a priority has to be that we as link workers are okay. We bring a social model to sit alongside a clinical one, and we have an emerging practice. The job we have to do is complicated and nuanced and involves significant emotional labour. Our support mechanisms, training and professional development opportunities need to reflect the state of the field. They need to value and reflect this complexity, be leading edge and be drawn from the best and most advanced practice. We need offers that are relevant, robust, well developed, engaging and expertly delivered. These must be respectful and suitable for the beginner as well as stretching for the most advanced practitioner.
And we must be looked after. Self-care is important, but we also expect to be cared for. Too many link workers find themselves in situations where basic rights and conditions are not in place or adequate. Employers should interrogate their practices, not assume they are getting it right, and have open conversations with their link workers, because this not only undermines their sense of value, but also their ability to do the job. Link workers must have proper pay and conditions, such as contractual arrangements, a place to work, appropriate kinds of support and supervision, robust systems, policies and procedures, and access to equipment and resources.
Understanding that we are not plugs or plasters. We know that being able to offer our clients time is a privilege. The breadth of work means it's easy for others to misunderstand our roles and responsibilities, and for us to be drawn into tasks that should not be ours. We're generous and we're team players, but to continue offering the important time to our clients, the boundaries of our role and remit need to be respected.
We need voice. It's our job to become expert at social prescribing, evolving as it is. We need to be involved in shaping its practice and in planning any development of our services. For a better service and a happier workforce, make sure we're at the table. We need budget. We're good at our work, but we're not magicians. We need financial resources to be able to do some aspects of our work, little things that make all the difference. And it's unrealistic to think that we don't.
These are our thoughts, and we'd love to hear yours. You can tweet your response to @Arts Derbyshire using the hashtag Link Worker Manifesto, or email deborah@artsderbyshire.org.uk. Thank you very much for your attention.
Brilliant. That was really great. Thank you all so much. I am going to jump straight into the next section, which is to ask our guests for their comments on the manifesto. But yeah, that was exactly as Michaela just said. What an interesting and beautiful film. Really great. Thanks for all your efforts putting that together. I think I will, if it's all right, I'm going to jump in and ask Marie if she wouldn't mind commenting on that. So Marie's with us from the Social Prescribing Network.
Hi Victoria, hello everybody. Really great to be with you here today. So my name's Marie Polly, so I co-founded, co-chair the Social Prescribing Network, and for audio description, I am a middle-aged white woman. I have long brown hair, I'm wearing a microphone headset, and I am sat in a room, but I've got a blurred background, so so people on this call are trying to work out what is in my room because they can't quite see it, but that'll keep them busy whilst I'm talking. So what a fantastic film, first of all. So I just wish we were in a room and we could all be clapping, because that was absolutely fantastic. The first thing that struck me when I listened and watched this film was how great it is to hear the voices of link workers. I think you're talked on behalf of a lot. I know I talk on behalf of you a lot, but just so great to hear in your own words everything that you do and your thoughts. So fantastic. And one of the last points was about, you know, your voice needs to be involved in everything. And I suppose one of the messages I've always put out is that designing anything and getting schemes together requires every stakeholder's voice around the table. So the time needs to be made in your day, doesn't it, so that you can take part in those discussions. Another thing that really stood out to me was the way in which you described your role, and things like, you know, one step in front of another. You see a person, their self-efficacy is non-existent, and just helping a person put one step in front of another is actually such a crucial thing when someone's in a very difficult place. And I love the idea that you're hearing a person, but I love the idea that you're wrapping yourself around a person, and that we say individualized or personalized, but that to me felt like a hug as well. We wrap ourselves around a person when we hug them, and that love and all of that, and that is I'm going to steal that description now and use it forevermore. And I love Pete, when you were talking about digression, and I kind of made me think digression is often seen as almost a negative thing, but in this sense it's a really positive approach to allowing a person to unpack. And we don't unpack in a linear way, we kind of do this and then we do that, and that digression and allowing that and hearing. So I love that. And then just a couple of other points before I hand over to the next person. I think there should be no apology for talking about pay and conditions. And I don't think it's a dry subject. I think it's the most important subject, because without the right pay and conditions, you won't do your job, you won't stay in your job. And we need you in your jobs, and we need you there keeping those relationships with people, because it's the relationships you build with your clients that actually are a fundamental mechanism to them changing. And I know that NHS England have been working a lot to put professional development framework together, which they're putting out to get comment on at the moment. So it's really important that everyone here comments back on that, and your voice is in that work. But you should be cared for, absolutely. And I've heard all sorts of stories around the country of where it's going really well and where it's not going well, and we feed all of those back to senior leaders as well. And so I am on your behalf constantly talking about pay and conditions and caseload. I just wanted to end really with saying, so I want to acknowledge the really amazing work and the value that you as link workers bring to this world, to people's lives, and the sort of the courage and the time that you've taken to put this out there and stand up and put this message out. And I just look forward to walking this journey of putting this message out with you. And so a really big well done, and thank you so much.
Thanks, Marie. That was really great. I'm going to hand straight on to Richard, if that's all right, who is from Arts Council England.
Thanks. Yeah, I'm some London area lead for work in creative health at the Arts Council. I'm an older white man with a traditional white shirt and a traditional book-lined study, and occasionally when the light catches my glasses, I have a faintly sinister look. But yeah, no, this is a great, the manifesto. I've enjoyed reading it. I've really enjoyed the presentations and it being spoken in that way. It was very moving. So I think one of the things I thought immediately was that link worker is a very inadequate term for the work that you're doing. It's not just about a link in some sort of chain of command or just attaching one thing to another. And I started to make a list actually of all the things that might describe the work that you, the link workers, do. And key, of course, is the pioneers. And the first 1,000 were appointed not that long ago. There's a lot of work still to be worked out, a lot of ways of working to be smoothed out. And as you say, paying conditions is yet to be sorted properly. You're expert generalists, so you need to know about what's on offer in terms of sport or the natural environment or arts and creativity and so on. But you need to be expert in those and be able to advise people and to guide people. Guides is another way you could be described as well. Translators. I mean, working in the arts, one has to get to grips with the health sector and all its acronyms and complex structures and so on. And I think translation is a really important part of your job. Listeners, and Marie's already picked up this lovely phrase about wrapping round the shape of the individual. So you're kind of shape shifters according to who you're talking to and helping. You're emissaries and ambassadors for a more holistic approach to health and well-being. And sometimes you are called navigators, of course, but you're navigators and explorers of what's out there, what the assets are in communities that can help people to be healthier and lead happier lives. So I think in a way, the link workers, in a very real way, you embody the kind of social model of health. And your work is a kind of litmus test for the success of social prescribing. Can it work? Does it work? It really does depend on the work that link workers do. Now, at the Arts Council, we're about to publish, I can't really talk about it in detail because it's not yet published, but we do have a creative health plan for the whole Arts Council. And that's going to be launched next month. And this will certainly fit right into that, that strategy, that plan. I'm going to share this today with the rest of the staff at the Arts Council, particularly the champions for this work across the Arts Council. I think it'd be valuable, really valuable, in explaining what the link workers do and what that whole program is about. In terms of London, obviously I'll be sharing it, if it's not already shared, with the Greater London Authority, Healthy London Partnership, London Arts and Health, and so on, to get this really excellent document out there and acted upon, because it's a kind of great explanation of what you do and what you need, and it's a sort of call for proper recognition and support for the work you do. In London, we are working with a performing medicine program, an arts organisation that has worked in medical settings for a long time and is now working with link workers, artists and cultural practitioners and health professionals, GPs and so on, to do that translation work. And that work with link workers, I think, is very important, and it does, you know, inspire me to explore how much further we can do in this area of bringing artists together with link workers and working, because link workers are, like all of us, are creative people. And I think what Deborah Munt and her team have done at Arts Derbyshire is show that it's made simpler in a way, that challenge that we have of explaining the cultural offer to link workers. If we work with link workers directly and work with them creatively, then that becomes a lot easier to explain and I think probably I've outlasted my slot there, but I'm very enthusiastic about it, and well done to all concerned. Fantastic. Thank you.
Thanks, Richard. And it's great to hear that you're going to share this inside the Arts Council. And I've heard from Dulcie as well, who's also with us, who's said the same thing. So yeah, really delighted that it's going to fit with the creative health plan that the Arts Council is producing. So yeah, all really good news. I'm going to pass on to Najneen, who is from the National Academy for Social Prescribing. Welcome, Najneen.
Thank you, Victoria. Thank you so much for having me. So I'm Najneen. I work at NASP, National Academy for Social Prescribing, as Head of Workforce and Infrastructure. For those of you that can't see me, I'm a South Asian woman, specific Bangladeshi, and in a very sort of grey room, quite messy, thankfully you can't see that bit. I used to work at the Bromley by Bow Centre, managed the social prescribing service as a link worker, and actually when I saw this video a few days ago, I was really moved. You can often tell when something has been produced and led by link workers, and something that really stuck with me was Pete's word, we're not magicians, and actually the ask is there of us to be magicians as link workers. So that really stuck with me. I think it's so valuable to have something put out by link workers for link workers, and the ask of what we actually do need as link workers. Things that really stuck out for me was 3 issues. The support for link workers, and that's been, I think we all say it, we all know it, but we don't hackers all, I think, for everybody. So yes, NHS England through policies, I think local level PCNs and how to embed link workers, the voluntary sector, local authority. And I think the one thing that comes to mind is we still don't we talk about partnerships and collaboratives, but no one really does it really well. Your patchy pots. And for example, the story of Bromley by Bow Centre, years to get to where it was now. They're often referred to as the pioneers, like the social prescribing, but it took about a good 20 years to get to where it is. And unfortunately, you know, with our populations and helping the people, we don't have 20 years to get it right. So what can we do now? And I think this manifesto is quite clear. Can systems, stakeholders, partners really speak to each other to really co-produce meaningful solutions together in communities. Everyone's responsibility in supporting link workers, and I think understanding the role is one of the biggest hurdles we have to tackle. So I think somebody mentioned about remits. It's such a broad role, and so that often makes it really messy. Sometimes we're like the interim to a social worker, as well as like a consultant psychologist, because everyone's on a waiting list. However, what I do find really interesting, so I was reflecting on this the other day, with that, you know, we're not magicians, is it's amazing how far the health that they're often now coming to a link worker saying, I don't know what to do with this person, can you help? So that shift in culture of, okay, we're understanding it's not all about medicine, and which is great. I think the next step is really weaving everyone's sort of resources together and sharing, you know, whether that's data, what the issues are, and overcoming those issues. So now is the time to sort of like mitigate everything. And that I think there's collective responsibility for all of us to really support link workers. I think link workers are people that often help are most vulnerable in our communities. I do wonder, like, if link workers weren't around a pandemic, where would we be? I often, like, it's just, I think it's such an important role, and I'll do everything in my power to make sure that link workers are supported. So I'm a champion for link workers, and I'll leave it there, and thank you so much for having me, and great to hear from everybody.
Thank you so much. I think that's so interesting what you said about the time that it took to embed the work at Bromley by Bow, and how we need things like this manifesto to sort of fast track the way that we think about this work, so that we don't have, as you say, we don't have 20 years to get this working. And yeah, really appreciate you coming today. Thank you. And on to Sarah from Derbyshire County Council.
Hello there.
Hiya.
Thank you. It's lovely to be here this morning. I'm Sarah Baines from Public Health in Derbyshire County Council. I describe myself as a middle-aged white female with curly, faded pink hair because I need to re-dye it and I haven't been given it any attention. And my background is actually, I realise I'm in my kitchen, but I realise I've got lots of wooden doors behind me, which makes it look like I'm probably in a corridor, which I hadn't thought about before. So there we are. I have to say that of all of my bits of work that I do, working with Deborah and the Social Prescribing Link Workers on this has been one of the most exciting parts of my work, because it opens up the world in so many different ways. So I've got 3 points really. One is to talk about the wonderful approach of Arts Derbyshire and how excited we are to be working in such a different way, because we haven't been used to creating spaces for conversation and provocation. And this technique that's been brought in is something that is just so, delivers something totally different and brings about such a different feeling of how things are for people and what it looks like. And we need to do more of that, because how things feel is so important. So it's not only the understanding of arts that has been happening, but it's also how arts can do something different for us and open up forums and bring out conversations. And that is just wonderful, and we're looking to do more of that. I also wanted very much to commend the bravery of the Social Prescribing Link Workers, because it's hard enough coming into a job that's so difficult, but then to have the bravery to talk about those difficulties in a time when everything was so difficult as well in the world, I think takes amazing bravery. And quite often I think people might go down that path and then get a bit shy and run away again. So the fact that you've actually really gone through this and kept going, I think has been amazing. And you should be so proud of what you've produced, because it looks great and it sounds great. And even better, it feels good. And what it's putting across is the feeling of what things have been like, and the feeling of what it's like to work so closely to someone who's coming to you in such a vulnerable way. So when I hear the word person-centered, I've heard that for years, I've used it myself for years, but your descriptions of person-centered absolutely chime so much more than I've ever heard from any other people talking about it. So I think it's amazing, and you're doing a wonderful job, and this is a beautiful manifesto for people to take forward. And finally, just to say that this type of working is really important. So working with the arts, working with Arts Derbyshire, we're wanting to do more of this from Public Health, because it opens up spaces, and we want to create more of those holding spaces and hearing what's going on for people. And we're going to do more of that, aren't we, Deborah, with Social Prescribing as a whole in Derbyshire, and looking at what the vision is for Derbyshire, because that's something that we haven't all agreed on. So if we have a vision of what we all think it is, then it's much easier for people to get involved, and it's much easier for us to pull in all of the different aspects that could support people in their lives. So I'm very much looking forward to doing more of this type of work, and I learned so much from Deborah all the time. So thank you very much, everyone.
Thank you, Sarah. And I just want to acknowledge that how important that investment you're making in this work is, and the sort of, you can see already the reach that this work is having, and it's really great. Thank you, and thanks for coming today.